way we see trauma play out is obviously on a spectrum. So as I mentioned, it can have short-term and long-term reactions. So the key to providing support is that it occurs in a timely manner and providing it immediately after the event occurred, as well as providing protections and supports to mitigate any long-term risks. And I'm going to share that a little bit with you at the moment so that we can work out how we manage support across the continuum. So this is our framework. It might look a bit complicated. I am going to step it out for you. So this framework has been developed for addressing vicarious trauma with workplaces from a prevention and an early intervention perspective. Some of you who we've worked with in terms of mental health training might notice the recognise, respond, refer, review model that we purport. So we're actually going to step through it in terms of what can you do in terms of prevention and what can you do in terms of intervention. So from a recognised perspective, so recognising from a prevention perspective is all about understanding your high-risk roles. So what roles in your workplace might have high psychosocial risk in terms of vicarious trauma? If you don't know these off the top of your head and don't immediately understand, there are easy ways you can go about it. You can actually talk to parts of your teams and try and work out see what's going on from their perspective. You can look at data, so your turnover data, your exit interview data, your engagement survey data, to see what's happening from that perspective. Something more sophisticated you could do is a formal audit or a job task analysis. We worked with a community services agency where we conducted a job task analysis on their high-risk roles to work out what were the elements of their roles that were risky in terms of trauma and what supports and controls were put in place to mitigate that and what other supports and controls could be put in place. So that involved focus groups, stakeholder interviews, even some psych testing to work out why are the high performers doing so well. So some people had been there for decades and the trauma didn't seem to have an impact. What were they doing well to mitigate those impacts of trauma? So we helped develop those identifying factors which potentially exposed the trauma, and what were the protective factors which actually helped, and what else could we do to actually assist in that space. And from that, a lot of training had come about in terms of how to support people in terms of mental health early intervention frameworks, which I'll talk about shortly. From an intervention perspective, obviously recognise means understanding the early warning signs. So we know the early warning signs are changes in physiology, your mood, your behaviour and your thoughts from a general mental health perspective, and certainly we need to keep all of those on our radar when we're checking on our people and noticing, gee, something's changed, something's different about them. But for our high-risk roles, we need to go one step further. We need to understand what the early warning signs are for someone who might be exposed to trauma and like I said, knowing what those high-risk roles are. So is it witnessing the content, reading the content in discovery of a testimony which was traumatic in nature? Did that kind of give people agitation? Did it give them an emotional reaction? Did they cry? Are they suddenly having nightmares? Those sorts of things we need to understand. People with trauma also have an increase in gastrointestinal complaints. We also know that they can be more on edge just generally, so it's coming across in an anxiety presentation, but more of an acute anxiety presentation. And these can be short-term effects because they might have read something which was terrible, or cumulative in nature, as I mentioned. But recognising those early, whenever you pick them up, is really important because then you can take action. The next piece is obviously the respond piece. So what do you do when you know there are high psychosocial risk roles in your workplace? How do you prevent people from going off work on workers' comp, salary continuance, or becoming high risk because they can't take it anymore? So it's then putting frameworks and systems in place to be able to make sure there are mitigating factors to offer support. And those are really key. So we know two of the key things for any mental health condition is obviously leadership support and peer support. We know from the research in terms of trauma that leadership support and peer support is crucial, and doing it early and doing it in a timely manner. So leadership support is obviously that role of supportive leadership, making sure you've got systems and frameworks in place so that the leader is checking in on their employee. I've got your back, I'm looking after you, I'll take care of you. We've worked with police in the past, and we've seen that a commander who was actually had that supportive leadership approach would actually have someone recover from PTSD earlier, recover from the effects of trauma quicker because they knew the commander had their back. So making sure that that leadership capability is in place. Equally as important is that peer support, peer-to-peer support. So call it venting, call it debriefing. If you've read a terrible matter, if you've heard a terrible piece of information, if you've just got off a really horrible call, having that opportunity to breathe and debrief. So getting it off your chest. We know that peer-to-peer support, from a neuroscientific point of view, it releases that oxytocin. So even though the situation hasn't changed, that person on the phone was really awful to deal with, by actually releasing that oxytocin, you're going to calm down your stress response. So that building in peer-to-peer support programs is really important, and allowing people that moment to breathe after that particularly difficult situation where they've had to read, hear, or see something terrible. We've also worked with selection processes, so working on particularly challenging matters which are long-term in nature, having a selection process where people have to, as a part of their psychological profile, checking in to see if they've got the necessary kind of resilience to kind of be able to work on that. We worked with a law firm in that space, and what we found as a part of providing a realistic job preview for those employees, that they'd sometimes select out. They'd do the realistic job preview, they'd probably read an example of what was traumatic content that they're likely to see on a daily basis in their job. I've seen people end up in tears, and then through the debriefing, they've said, I actually don't think I want to go on this matter. It's like, fair enough, that's great. So that's selecting out by actually having those selection processes in place to work out, is that actually okay for them to go on the matter? And if it is okay for them to go on the matter, what supports do we need to put in place to make sure that they're sustainable to work on that matter? All of this contributes to developing that psychologically safe work environment where that person can bring their whole self to work, because my peers have got my back, they're looking after me. If I have a challenging call with a customer or something difficult on a matter, my leader, my partner is going to look after me. They're not going to chuck me out of that matter. They're going to look after me. And that's psychological safety, where you can bring your whole self to work. From an intervention perspective, obviously, we have the Are You OK conversation. So having it timely, making sure that as soon as you've noticed a change in someone, you're actually checking in, saying, I've noticed a change, you haven't seen yourself, are you okay? I want to see how I can support you, is really powerful. And making sure that you don't watch and wait. Oh, they seemed really distressed after reading that document and they've ended up in tears. I might watch and wait and see what happens. I can guarantee what will happen. They won't be able to process it adequately, and something else will come up, and you'll have that accumulative effect of trauma. So making sure those Are You OK conversations occur in a timely manner is really crucial. Then we talk about referral options. So from a prevention piece, as we've seen in terms of implementing those systems and frameworks for leadership support, peer support, we also need to do that education piece to make sure that people are aware of what are the early warning signs for mental health, for vicarious trauma. How do you look after yourself? What are the short-term things you can do to look after yourself after you've experienced a traumatic call or read something traumatic or heard something traumatic? What are some things we can do to top up your resilience so that if this happens again, you are buffered from the effects? And it's looking at supportive leadership training. How can a leader promote more micro-affirmations and minimise the extent they're using micro-inequities in the workplace and build psychologically safe workplaces? From an intervention perspective, our referral options mean obviously using your EAP. EAP is a great first port of call, but remember it's a fixed amount of sessions and it's not a one-stop shop. So if someone is experiencing significant trauma or to the point of having PTSD, having EAP where you've got your 3 to 6 sessions isn't going to be enough. We need to get them into best practice treatment. We often work with people where a people leader will say, well, they're in treatment, it's fine. But you've actually got specialised treatment to support someone who is actually experiencing significant trauma. And they have to be done by a specialist, accredited practitioner in that space. The two types of best practice treatment are trauma-focused therapy and EMDR. So, and either of those, you need to be practiced, you need to be accredited in that space to be able to be skilled to provide that treatment. The treatment is long-standing, it's not going to be dealt with in 6 sessions. The average session length is 12 to 16 sessions, and for multiple traumas it could be even longer. So whilst your EAP will be a great triage service, if there's an opportunity that your EAP can then have with consent, have a conversation to loop them into more support, then that's important as well. Another intervention piece, which Megan will elaborate on, is the wellbeing check. So having periodic wellbeing checks, particularly in situations where you know that there are roles with high psychosocial risk, where there's high risk of exposure to trauma. By having independent wellbeing checks, you're having an independent person regularly check in, how are you going, how's that matter going, what's working well for you, what's not. We can track the changes in the person's functioning. So if we see a change in their physiology, mood or behavioural thoughts, we can take action quickly. And the benefit of having someone doing independent well checks is that they don't see the person every day. So the change that you notice will be more stark than something which is subtle in nature for someone who observes them every day. Finally, we talk about review. And the key to review is making sure that you're regularly reviewing your psychosocial risks, reviewing the efficacies of the frameworks in place, and having the managers check in. We know with the constant changing nature of work that obviously culture changes at work. One of the big emerging risks that we see in this space in terms of trauma is the flexible, agile workplace, which is great in terms of productivity, in terms of being able to kind of work in any different location, but in terms of the role of supportive leadership and supportive peers is an incredible risk in terms of someone being able to fly under the radar. We know when people are experiencing trauma that they're less likely to come forward because of the stigma associated. I'm weak because I've reacted to this situation. I'm silly because I've reacted to this situation. They're all stigmas attached to trauma. So we need to really be tuned in a proactive space, particularly with people who are working flexibly or agile, to get that visibility, to check in. It could be once a week, it could be once every couple of days, but just to make sure that you can track the changes. We've heard situations where working with employers and they've tuned in to, well, they didn't on their regular webinar call that they have once a week, someone stopped turning on their camera. They're refusing now to turn on their camera. I wonder why that is. They never used to be shy about turning on their camera previously. I might have a check-in call with them and then finding out actually they're not okay anymore. So that's where we really see the challenge of managers, leaders being tuned in to the changes of the workplace. And obviously from an intervention perspective, we need to make sure that we continue to check in to make sure that person maintains that path to recovery, and also review, is there anything we missed that we could do for next time to prevent this from happening again? What did we do well? How can we evolve to make things different for the next time?